Growing up comes with many exciting opportunities, but it also comes with important decisions. One of those decisions is taking responsibility for your sexual and reproductive health. Unplanned pregnancy can affect your education, goals, relationship, and future, especially when it happens during the teenage years. It can also increase health risk for both the mother and the baby, including the risk of premature birth.
Everybody, I'm Amy, your facilitator for this month's awareness. And in this session, we'll have an open and honest conversation about the realities of why babies born too early need special care. Most importantly, we'll learn that preventing unplanned pregnancy is everyone's responsibility by making informed choices, respecting ourselves and others, and supporting one another. We can build healthier futures for ourselves and our communities. So, grab your books and pens, take notes of the key points, and join me on this journey as we explore. And also, do not forget to share the video with your friends, family, and loved ones, so that together we can create awareness and promote better reproductive health. Thank you.
Next on our list, we have prematurity. Prematurity, also known as a preterm birth, refers to the birth of a baby before 37 weeks of pregnancy. The earlier a baby is born, the greater the risk of a serious health complication, because many of the baby's organs, especially the lungs and the brain, may not have fully developed. We have types of prematurity. Prematurity is classified based on the baby's gestational age. We have late preterm, that is 34 to less than 37 weeks. Moderately preterm, which is 32 to less than 34 weeks. Very preterm, which is 28 to less than 32 weeks. And extremely preterm, which is less than 28 weeks. About 1 in every 10 babies worldwide is born prematurely. Risk factors for prematurity. Certain mothers are at a higher risk of having a preterm baby, including mothers younger than 17 years or older than 35 years. Multiple pregnancies, that is, if the mother is expecting twins or triplets. Smoking, alcohol or substance use during pregnancy. Personal or family history of preterm birth. Causes of prematurity. Preterm birth may occur due to placental problems, preeclampsia or eclampsia, which simply means hypertensive disorders in pregnancy, problems with the uterus or the cervix, vaginal bleeding during the pregnancy, infections during the pregnancy, or substance abuse during the pregnancy. Well, how are you going to know if a baby is born prematurely? 1. The baby will have a low birth weight, experience breathing difficulties, have feeding difficulties, will need specialized medical care in a neonatal intensive care unit to support breathing, feeding, and growth. Some complications can arise due to this premature birth of a baby. Premature babies are at a higher risk of anemia and newborn jaundice, that is, higher levels of bilirubin in the blood. Neonatal sepsis, bleeding into the brain, which is also known as intraventricular hemorrhage. Latent ductus arteriosus, retinopathy of prematurity, caused by abnormal development of blood vessels in the eyes, which can affect vision, hearing problems, learning disabilities, and developmental delays. Prematurity can also affect parents emotionally, increasing the risk of anxiety, postpartum depression, and post-traumatic stress disorder. It is important to note that being born prematurely is not a disability, but it can increase the risk of certain long-term health and developmental challenges. How is prematurity prevented? Although not all preterm births can be prevented, the risk can be reduced by attending antenatal care early and regularly, eating a nutritious balanced diet, taking prescribed prenatal supplements including folic acid, avoiding tobacco, alcohol, and other harmful substances during the pregnancy, managing medical conditions such as diabetes and hypertension, reducing stress, and getting adequate rest is very important.
Thank you.